The clavicle or collar bone is a long bone in the sense that it has a shaft and two distended ends. Since the clavicle lies horizontally, then in this case it has medial and lateral ends. In layman's terms, it serves as a strut between the shoulder blade and the breastbone, or anatomically speaking, between the scapula and the sternum. Together with the scapula, the clavicle makes the shoulder girdle. The clavicle receives its name from the Latin clavicula, meaning little key. It might look like an ancient key, but in addition, it rotates along its long axis like a key when the shoulder is abducted. Abduct your shoulder while feeling the clavicle. There are two clavicles, one on the left and one on the right, and sometimes you might be asked to differentiate between them as separate bones. In this case, you have to notice that the medial 2/3 is rounded and convex forwards. The lateral 1/3 is flat and curves back to meet the scapula. The upper surface is smoother than the lower surface. The lower surface has a rough area for the costoclavicular ligament, a groove for subclavius, and other rough areas for the conoid and trapezoid ligaments. According to what have just been mentioned, then this clavicle will be the right clavicle. This is the medial end. Here is the flat lateral end, and here it is convex anteriorly. Superior surface is smooth, and inferior surface is rough surface. So this will be the right clavicle, while this one is the left clavicle. Again, it has the medial end, which is rounded, the lateral end flattened. There's a smooth superior surface and a rough inferior surface, and so this will be the left clavicle. The sternal end of the clavicle has a facet for the sternoclavicular joint. This articular area extends to the undersurface of the clavicle for articulation with the first costal cartilage. The clavicular head of sternocleidomastoid muscle arises from the medial third of this superior surface. Anteriorly, pectoralis major is attached to the medial half of the clavicle, while the lateral third provides attachment for deltoid muscle. Trapezius is also attached to the lateral third, but posteriorly. So here we have trapezius attachment posteriorly, and just opposite to it, anteriorly, is the attachment of the deltoid muscle. Remember that the medial third of the superior surface provides attachment of sternocleidomastoid muscle. Sternocleidomastoid and the trapezius, they provide boundaries for the posterior triangle of the neck, and the bare bone in between their attachment is the base of the posterior triangle of the neck. This part of bone is crossed by supraclavicular nerves. It should also be remembered that the bone here is also covered by some fibers of platysma muscle, the muscle that is located in the superficial fascia of the neck. This is the lower surface. It shows a rough area here next to the sternal end for the attachment of the costoclavicular ligament. It also shows a groove for subclavius muscle, which occupies the middle third of the inferior surface of the clavicle. The clavipectoral fascia are attached to the margins of this groove. Thus, the clavipectoral fascia splits superiorly to enclose the subclavius muscle. The same fascia splits inferiorly to enclose pectoralis minor muscle. Lateral to the groove of subclavius, note the conoid tubercle. Here is the conoid tubercle for the attachment of the conoid ligament. And from here, a rough trapezoid ridge extends obliquely to near the lateral articular facet, and this provides attachment for the trapezoid ligament. So the conoid tubercle and the trapezoid ridge. For the conoid and trapezoid ligaments, the coracoclavicular ligaments. The acromial end here has a facet for articulation with the acromion process of the scapula. This is the facet for articulation with the acromion at the acromioclavicular joint. Fracture of the clavicle is common The break is always between the costoclavicular and coracoclavicular ligaments, conoid and trapezoid ligaments, each of which is stronger than the clavicle itself. The clavicle is the first bone to ossify in the fetus. It does so in membrane, so it's membranous ossification, and a secondary center appears at the sternal end during the late teens and fuses rapidly. Here we can see that the secondary center of ossification has not been completely fused yet in this clavicle.